welcome to another empowering edition of Feminine Focus. My name is Fausat Jinado Hassan, your regular guide. And you can send in your comments and contributions to our social media handle on TikTok and Instagram at Feminine Focus _NTA Kaduna. Today we are diving into a topic that is close to many hearts and affecting countless mothers across Nigeria. I mean, postpartum depression. We'll unpack the signs, break the stigma, and explore the support that is out there for our mothers. So settle in, grab a cup of tea as we keep the conversations real and compassionate.
While joy, prayers, endless visitors, and celebrations surround the arrival of a newborn, many mothers experience a wave of sadness, anxiety, and exhaustion that doesn't fade after the first few weeks. In Nigeria, where motherhood is often celebrated as a communal blessing and a sign of strength, postpartum depression remains a silent battle, one that many women keep hidden out of fear, shame, or the belief that it's just the baby blues. Recent surveys suggest that up to 1 in 5 new mothers in urban centers and 1 in 3 in rural areas may experience symptoms of depression in the first year after delivery. Yet, less than half seek help, often because they fear judgment and feel they are failing at the very role society expects them to excel in. Postpartum depression is a medical condition, not a personal failure. Hormonal shifts, sleep deprivation, cultural expectations, and the pressure to be the perfect mother can all contribute. Recognizing the signs early can be the difference between a mother getting the support she needs and silently suffering. Across the country, initiatives are emerging that runs free counseling sessions in primary health centers, while NGOs distribute information on flyers in local languages, encouraging women to talk openly. Social media is also breaking the silence. Mothers are using platforms like Instagram and TikTok to share their journeys, creating a virtual sisterhood that many never had in their neighborhoods. As we prepare to hear more from our guests today, remember, recognizing the signs is the first step towards healing, whether it's a friend offering a listening ear, a family member helping with chores, or a health worker providing a referral. Reaching out can make all the difference. Stay with us as we dive deeper into postpartum depression on Feminine Focus, because every mother deserves support, understanding, and hope.
Thank you for that powerful overview. Now we'll bring in our guest, Dr. Saada Sani Suleiman, a registrar doing her residency program in the field of psychiatric at Federal Neuropsychiatric Hospital, Kaduna. She's passionate about maternal mental health, and she's also a poultry farmer with over 2 years of experience. She also enjoys traveling and reading novels. All right, Doctor, thanks for joining us. Let's dive into some of the key points you just heard and hear your insights on how we can better support moms across Nigeria.
It's a pleasure to be here. Thank you so much for having me around.
So, Doctor, could you start by explaining in plain terms what postpartum depression is or looks like for a new mom?
Postpartum depression, simply put, is a mental health condition that presents with depressive symptoms, and then it affects women during the time they're pregnant, but it can also occur after they deliver, and it can extend up to a period of 6 weeks. That's the postpartum period, although some women can have its symptoms occurring up to a year. And normally it's common for women, about 3 out of 4 women, to have some symptoms of sadness or experience fluctuation in their mood. They might even have weepy spells, they might be anxious about their health or their baby, and they might feel overwhelmed with that new position of motherhood. This is known as postpartum blues. So, but it differs from depression in the sense that depression is not just sadness, it goes beyond sadness. It's an emotional battle, struggle that a woman will have. And then about 1 out of 10 women have this condition. And then it usually occurs from 2 weeks after delivery. But then the exact cause is not known, and it can be attributable to the majority of the physical processes, the changes that goes on in the woman's body, mainly hormonal fluctuations, and then also coupled with sleep deprivation and the new task of caring for herself and the baby. And then also, there are some risk factors though that are associated. For instance, women that are within the extremes of age, either being a teenager or after 35 years of age, or her experiencing her first childbirth, or even a woman that is having multiple pregnancies. Maybe she's carrying twins or she's having triplets and so on. A woman that is facing a lot of domestic violence, a woman with who lacks support, emotional support from her family members or her spouse, and then also a woman who has experienced a traumatic birth experience, maybe a cesarean section or any other traumatic experience, either during pregnancy, like she might be having obstetric complications, or after delivery. And then also a woman who has a pre-existing diagnosis of depression, or one who has experienced postpartum depression in a previous birth.
Okay, many women say they fear judgment or think it's just, the baby blues, just like you said. How do cultural expectations shape the silence around postpartum depression of a thing?
Yes, very well. A woman is just expected to jump into the motherhood role after having a baby, be it her first experience, her second experience, or what have you. And then also the fact that mental health in itself presents with symptoms that are kind of strange. So there might be some fear of stigma or attribution of it to being of a spiritual nature rather than a mental health illness. And then also, the fear of being judged. She doesn't want to be seen as weak. She doesn't want to be seen as running away from the responsibility of motherhood. And she doesn't want to be judged from being called a bad mother. So all that, because, if she says she's experiencing all these things, people will tell her that, okay, be strong. Other people have experienced it before. Don't worry, it will go away, not knowing that it's leading to a very serious condition.
All right, let's take a look at the prevalence of postpartum depression. Recent studies suggest that up to 1 in 3 rural moms experience postpartum depression. So, what do you think drives this high rate compared to urban areas?
Generally, like you said, both women in the urban area as well as the rural area, even the most developed societies, can experience postpartum depression. But however, a woman living in the rural area might be predisposed to some other risk factors that will put her more at risk. For instance, usually early marriage or multiple pregnancies. What I mean by multiple pregnancies is maybe a higher birth order might be commoner in the rural area compared to the urban area. And also the access to healthcare services, specifically mental health care services, might be lower in the urban area and the rural areas compared to the urban areas. And she might also be experiencing some other factors like malnutrition, which can all couple up and increase her chances of coming down with postpartum depression.
Okay, in that sense, what are the red flags, or let me say those signs to watch out for that indicates it's more than just exhaustion?
Any woman that is having persistent feeling of sadness, she feels empty, it might just be presenting as her crying for no reason, or she's even withdrawn, she's isolating herself, she doesn't want to mingle and interact with other people, or she's even always feeling exhausted and tired. She's either having sleep problems, which can go either way. She might be sleeping too much or sleeping too little. She's not getting any sleep at all. She might be experiencing problems with appetite, either not having appetite to eat or binge eating. She's just eating too much, or she might even go to the extent that she's feeling hopeless, worthless, and helpless about herself, the future, and the baby. And this might even progress to her having thoughts of harming herself or the baby. So, all these are alarming signs to show people that this woman might be experiencing postpartum depression. And these symptoms must have been persistent and ongoing for at least 2 weeks before we can make this diagnosis.
Okay, then, doctor, what is the first step you recommend for a mother who suspects she's struggling actually?
Okay, so when she's experiencing these symptoms, she should reach out. She should confide in someone that she trusts. It could be her partner, it could be her spouse, it could be a friend or a close family member. And then when she reaches out, she should seek for professional help. When she does this, because it's manageable, it's treatable, and early detection and prompt treatment will improve the outcome of this condition in her.
Okay, you just spoke of some support system, but you didn't really go deeper. So how can community health workers, religious leaders, or family members be better allies in the recovery process?
Okay, let me start with the family, because they are the closest people to that woman, that woman that is pregnant, or that woman that has just delivered. So it's a good thing in Africa that we have this our omugo, whereby when a woman delivers, she has family members around, maybe a mother-in-law or her mother, that will come help to care for the baby, and then also help with the house chores, and also care for the other children if she has. So this is a very good traditional practice that we have. However, what the family, should can go beyond that, because in that sense, we tend to focus more on the physical. Are you feeling pain? Are you has your bleeding stopped, or are you bleeding too much? And we care for the baby too. So, but nobody really asks, how are you doing? Are you doing well? Are you okay? And the rest. So we should have, like, the families should create safe spaces for women to feel free to voice out their feelings without being judged as being bad or being weak. And then also, for when they see the alarming signs, they should take the woman to seek for the professional help as early as possible. Then on the road for the community health workers, because they are at the community, so when these women come for antenatal care, they should educate these women about the alarming signs, so that they are able to recognize it in themselves. And then when they feel so, they can voice out their feelings and experiences. And they can also educate not just the women during antenatal, they can organize outreaches where they can educate other members of the society too. Then for the religious leaders and the community leaders, we tend to live in a very religious kind of setting, and so people listen to their cleric or their pastor, and we hold that whatever they say close to our hearts. So we can also, during our sermons, they can pitch in some thoughts about mental health, especially about postpartum depression for women, and encourage them. And the community leaders should encourage our other leaders. They should liaise so that policies are made for better access to healthcare, especially around the rural areas, and specifically mental health care in this regard.
Okay, then let's talk about the resources that are available for women with postpartum depression. What free, or let me say low cost services are available right now across Nigeria for moms or for mothers with postpartum depression?
So on a lighter note, let me give one like the Omugo I just mentioned. So it's cheap, it comes easily accessible and very reliable. Then also there are some non-governmental organizations that partner with some governmental bodies to educate women on this, and they can also help in um, linking them up with mental health care services. And also here in Kaduna, we have the Federal Neuropsychiatric Hospital at Barnawa, where women that are experiencing these can have treatment and support that is needed.
Okay, you said NGOs are available to help women with postpartum depression. So, how effective are they reaching out to women who might not want to leave their houses? Because, of course, there are women that maybe as a result of their cultural expectations or whatever, they might not want to come out from their houses.
Okay, they are quite effective, but you know that as mental health care is still an evolving aspect of medicine, and people are still, though awareness has increased, but people are still becoming used and getting more acclimatized to it, and so is the care and all. But the non-governmental organizations are quite effective, and not just non-governmental organizations. Sometimes there are people that volunteer as individuals. They might see someone suffering, and then they decide to take it upon themselves to help and sponsor the treatment of these women.
Okay, do you have a brief example of a mother who got help that she needed and she's now thriving?
Okay, yes, I do. I remember this particular woman. She was young, in her early 20s, just had her first baby, and then everybody in the family was happy, and there were smiles, celebration, joy, and laughter all over the place. Fast forward to the naming ceremony of that baby, and then of course, from then on, that woman suddenly started experiencing. She was feeling sad. She would cry for no reasons, and then beneath that heavy smile, she said her heart was heavy. Beneath that smile, she had a heavy heart. And then she said when the baby was crying at night, she will also cry with the baby together. And then this became more progressive. She stopped interacting with her family members, stopped interacting with her friends. The baby will cry, 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 and she wouldn't even breastfeed. And then this woman even expressed to her family members that she feels that she's a failure as a mother. So she stopped eating, stopped sleeping, stopped taking her bath. Daily routines that used to be so usual for her. So luckily for her, one of her aunties who happened to be a nurse brought her to the hospital, and then she was seen, though she was on admission for a while, but she after a few days upon commencement of medications, she did fine. And as I'm speaking to you now, this woman is caring for herself, caring for her baby, and she's on follow-up visits to the hospital. Yes.
Oh wow, that's quite interesting to hear. So, on a final note, what's that one thing that you want our viewers out there to do today, if they or someone they know is struggling or needs help?
If a person is going through, is having these symptoms, or you know someone that is going through these experiences, so that person, if it's that's in, find a confidant, someone that you trust, and try and express your feelings and let it out to that person. And then also, when it's someone that you know that is going through this experience, you should also be that safe space that I talked of earlier, and try to find out. And if this is persistent, it has the symptoms are continuing, not responding to the talks or calm or reassurance, please bring the person. The professional help should be sought for early, so that whatever the person is going through will be evaluated, and if it is postpartum depression, it will be managed accordingly.
Thank you so much, Dr. Saada, for breaking that down for us. Let's go on a short break, after which the program continues. Stay with us because the conversation is just getting real.
I have something for you. Yes, you woman watching me. Yes, you. I want to let you know that you're a soldier without uniform. You're the very essence of life. You are the beauty of the universe. You are the strongest of souls in the most fragile body. You are the greatest of everything living. Don't let anyone tell you otherwise. You know why? Because you are the reason for continuity in every generation. And without you, there's no procreation. Yeah. So to you, woman of honor, woman of value, woman of strength, woman of beauty, woman of substance, I want to salute you and every other woman in the making. God bless us all. May all of our rewards be greater than all of our efforts put together.
Alright, thank you for being with us. If you're just joining, we've been discussing postpartum depression, a silent struggle that touches countless women globally. Now let's shift the gears and give you a quick practical tips you can start using right away to boost your well-being. Stay tuned. Thank you for staying with us through those tips. Hope they give you a little boost. That wraps up today's episode of Feminine Focus. Remember, you're not alone. Look out for one another and take care of yourself. Until next time, stay strong, stay heard, and keep shining. Goodbye.